Welcome back. I'm so excited to share a beautiful soul and physician and woman with you by the name of Keira Barr. Dr. Keira Barr is a trailblazer in holistic health, seamlessly integrating her dual board certified dermatology expertise with profound educational and empowerment initiatives. Certified in integrative dermatology and mind-body medicine, she excels in teaching stress management and skin health enhancement from the inside out. Her unique approach combines somatic trauma therapy, stress release, and breath work, making her a favored resource for those seeking empathetic, evidence-based healing. A global recognized keynote speaker, Keira frequently graces international stages and features in prestigious media outlets, sharing insights that bridge clinical science with the human experience. Her transformative sessions provide a comprehensive blueprint for vibrant living, empowering individuals to embrace holistic health confidently. Keira is more than a physician. She's a mentor and educator dedicated to refining skincare, health, and wellness. Well, welcome. I'm so excited to have you.
I know I've been really looking forward to this conversation.
Too. And I just have to add, all those accolades are incredible. And Kara in real life in person is like a magnet. Your like energy and essence is both like strong and confident, but also so like easy and flowing and kind. And it's just such a pleasure and a privilege to have gotten to know you.
I so appreciate that. And it's so funny because that is not how I would see myself, which I
Uh,
love. But right, that's why we do the work. That's why I
yes.
would say you do the work because you need to do the work.
Yes. Yes. And maybe that's a great place to start. Can you just share a little bit about how did you get to such a unique place in medicine in your life?
Yeah, it's so funny because about 9 years ago, my health really fell apart 12 years ago. But about 9 years ago, as I was kind of working through my own health journey, someone asked me, why did you go into dermatology? Now, if
Mm.
you had asked me 20 something years ago when I went into dermatology, I would have said, oh, because I love all the things. I love, you know, pathology, which is my what I did my fellowship in, and I love internal medicine and oncology and all the things because in dermatology you don't have to make a choice. You can treat kids, you can treat adults, you can do surgery, you can do aesthetics, all the things. But what I realized in that moment was going back to my own story in childhood. It made me remember that, as a kid, I was bullied for birthmarks on my skin. That at a very young age, I learned that my skin could be a source of shame and embarrassment and humiliation, and lived most of my life feeling very uncomfortable in my skin.
Mm.
And it led me really ultimately to my own health issues and challenges, which
Mhm.
we'll get into how these things get stored in our body.
Yes.
And it made me realize like the intimate connection between the brain and the nervous system, right? The mind and the skin are embryologically linked, intimately connected. And I realized that I went into this field to help people find greater comfort and confidence in the skin they're in. Because when we don't feel comfortable,
Mhm.
there's a lot of downstream effects.
Yeah. And I love your story, that your vulnerability to share that, because I think especially for high achieving or professional people, we value the cognitive, the knowing, and we tend to dismiss things that might appear superficial on the outset. But your story is such a great example that in the end of the day, we're human, and how even might our judgments be in the way of us seeing more, accessing more wisdom that is there waiting to support us and to be healed. So I thank you for sharing that.
Yeah, it's funny because, you know, not everyone has skin issues, but for me, right, your body's always talking to you, sending you little messages all the time, the aches, the pains, but we have been taught to kind of override them, overlook them, ignore them, mute them. Um, but it was my skin actually that really started shouting because even though I'm a brunette, my dad's a redhead. I inherited his, very fair skin, very moly person, and my moles were starting to grow and change and get darker and more atypical. And I was getting you know, more atypical moles requiring biopsies every couple of months until one was so atypical that we wound up diagnosing it as early melanoma. And that really was the wake up call for me that you can no longer ignore these
Mm.
messages. And really that really led me down this path. First, trying to do the external things like we're
Mhm.
taught, right? What pill do I take? What diet? What this? And no one was really connecting the dots, right? It was your hormones, it was your gut. Take this thing, do acupuncture. I did all the things.
Mhm.
Nothing was really shifting until I found myself in mind body medicine. And I was like, oh,
Wow.
there it is. That all the dots start to connect.
Wow. So tell us a little bit for people who don't know what mind-body medicine is. What does that mean?
Yeah. So essentially, it is the connection between our mind and our body. They're constantly communicating, but we have, thanks to Descartes, like we were taught that the mind and body are separate. We should just live up in our head, and our body is just this thing that that our head sits on top of.
Yeah.
Um, but it really is the integration of our thoughts, our feelings, our sensations can impact our physiology. So, in the scheme of like skin health, for instance,
Mhm.
there's what we call the NICE network.
Mhm.
And so it's the nervous system, the immune system, cutaneous, and endocrine. And they are all intimately interconnected. They're communicating with each other all the time.
Mhm.
I always think of the nervous system as command central, right? Because
Mhm.
our nervous system is like our personal surveillance system. It's always scanning our environment for cues of danger and threat. And when it feels threatened, whether real or perceived, it is
Mhm.
then going to send signals to your immune system to, rally up the troops and release those cytokines and inflammatory signals, which your skin actually has its own stress response system. It has its own HPA axis. So your skin is both a target and a source of the stress response.
Mhm.
It is an endocrine organ, a sensory organ, right? So then all the hormones kind of
Mhm.
can go out of balance. Body's going to prioritize cortisol, primary stress hormone. Anything deemed non-essential for your survival will take a back seat.
Mhm.
So, very long-winded explanation, but the mind body medicine is really understanding the intimate connections, understanding how the things, the stressors, how stress affects our physiology, and really empowers you to take back control of so many aspects of your health when you understand why things are happening, like why you make so much sense, why these symptoms are really happening because there is a root cause, right? Your
Mhm.
command central is getting signals that are keeping it on
Mhm.
alert.
I see. So it's almost like using your body as a messenger, as a mirror to help you understand how are you dysregulated or out of harmony with yourself. Is that the basics? Yeah.
Yeah, I would say, yeah. I mean, at least that's how I perceive it.
Yeah.
Uh, I know nowadays there's so much emphasis on gut health, right? Like
Mhm.
fix the gut, fix the gut. And I believe that's true. Like so much of our immune system is housed in our gut, neurotransmitters, our feel-good hormones produced in our gut, serotonin. But my question is always, well, what caused the gut to go out of balance in the first place? Why is there dysbiosis,
Mm.
right?
Yeah.
When we are in a state of chronic stress,
Mhm.
digestion is not a priority, nor is procreation. So the epidemic we have of fertility issues,
Mm.
gut issues, and really for me, for the way I perceive things, right? We all have our own lens, but
Mhm.
I really see this as chronic dysregulation of the
Mhm.
nervous system.
So let's say someone's listening to this, they're resonating with what you're saying, and they're identifying that their body is out of harmony.
Mhm.
What should they do next? How will they know? How do they piece back together the mind with the body?
Yeah. I think, first of all, it's being attuned, right? Sometimes people are like, oh, my stomach hurts, or oh, these aches and pains. And then they just address the symptoms with ibuprofen or whatever. I
Mhm.
think it's really an opportunity to get really curious, right? What might my body be offering me in the way of information,
Hmm.
right? And sometimes it is just looking at the bigger picture of diet and lifestyle, right? Am I the basic things I always talk about, like our senses, right? Tapping into our senses, which is an acronym for your relationships. Who are the people that you are spending your time with? Are they a source of joy or are they a source of sadness or
Stress.
stress? Um, and also that relationship to ourselves, right? A lot of us are very self-critical. I think a lot of us, myself included, that driven perfectionistic tendency. The more I learn, I realize it goes back to our attachment wounds as kids, right? Our worthiness could be tied to accomplishments
Mhm.
and getting attention. Um,
Yeah.
so relationships, looking at what are the stressors in your life,
Mhm.
right? It's environmental stressors,
Mhm.
it's visual stressors, like what are we consuming on our devices,
Mhm.
the personal products, the foods and things like that. Um, Environment, similar, like, what is in our environment. Um, Nourishment, how are we nourishing ourselves? Sleep is a big one. Exercise and movement, how much or how little, right? Like when
Mhm.
my health started falling apart, I was over exercising. I was running
Mm.
ultra marathons. And for my body, that was just too much. Yeah.
Yeah.
So kind of just doing, I guess, a personal audit, a
Mhm.
life audit
Mhm.
often will help clue you in if we were talking earlier about being really honest with
Mhm.
ourselves. And I'll name like, I can do myself better than anybody else. I'm doing all the things,
Me
but
too.
I'm doing all the things. But if you're willing to take an honest assessment, you might find, opportunities, not opportunities to beat yourself up, but opportunities to really make some positive, supportive shifts
Yeah.
that allow your mind and body to be able to communicate in a more harmonious way.
Mm. That's such a beautiful sentiment and such a beautiful, I don't know, almost reinvigorates an invitation to look at the body as wisdom, to look at it with awe and wonder. Like to your earlier comment, it's not just a machine that gets us from here to there with the crown as our, like with the head as the crown, but what's the role of all these other wisdoms that we hold to be in alignment with our most radiant selves, our most truest selves. And I love that invitation so much to remember our body and its messages. I guess
Yeah.
I'm curious with you're a mind body expert and a like traditionally trained or Western trained physician. How do you see those worlds coming together? Has that been a struggle? How have you found your way to integrate what you're describing now with the structures that are?
Yeah. Well, I'll name that I did leave traditional medicine when my own health fell apart, and to make some tough decisions. We relocated from academic, I was in academics, we relocated to another state. I thought I was going to just join practice, continue doing derm path, and my life took a little different turn. That opportunity didn't pan out, and I realized I'm going to put on my big girl panties. I don't want to just go back into clinic and write prescriptions. So I found myself just exploring different, working with a startup company, all these different things. Again, leading me back to really diving deep into mind body medicine, really first to help myself.
Mm,
And over the last 7 years, I've really spent a lot of time with the psychologists. I
mm,
feel I don't know. I find that in most trainings that I'm in, I'm the only physician among the psychologists and learning a lot about trauma.
mm,
And as a physician, I never understood what trauma was. I thought it was an event that happened to somebody and the aftermath of that because of the event. But what we understand now is that trauma isn't in the event, it's actually in the nervous system. It is how that event landed in our body and our nervous system's capacity to adapt to it,
mm,
right? Because stress is a normal biologic adaptation to something in our environment.
Hmm.
Trauma is the lack of capacity to adapt to that.
Mm.
So something that is traumatic for you, right? We witness the same car accident. We witness it. Depending on your lived experience and how much you're resourced, right? Um, whether you have people you can rely on, a community, purpose in life,
Mhm.
whether what your relationship with is yourself, seeing yourself as someone creative, kind, compassionate, you may walk away from that being a little shaken,
Mhm.
but you're able to come back to your baseline, you know, without too much difficulty, right?
Mhm. Mhm.
Reasonable amount of time. Me might witness the same thing, but because of my past experiences, maybe I was in a horrific car accident. I never got to process that experience, or I have no one to talk to about it. I don't have support,
Mhm.
right? It could send me on a tailspin and keep my body in a state of high alert vigilance, or to the opposite, I'm completely shut down, like it's too much,
Mm.
right? Whether it's too much, too fast, too soon, and I'm just like I can't handle it, and I'm just always on alert, feeling very anxious. My mind is racing, or something goes on for too long with too little support, and my body just goes into conservation mode. I do not have energy for anything else. The bigger picture, trying to loop it back to what your original question was, how do I bring this forward?
Mhm.
What we know from recent research, and it goes back, but there's more mounting research that many skin conditions have their roots in trauma,
Oh, wow.
especially the autoimmune conditions,
Mm.
psoriasis, alopecia, vitiligo. Right? If you look at the statistics, autoimmune conditions, it used to be maybe 70%, but it's now upwards of 80% of all autoimmune conditions are diagnosed in women.
Mm.
And when you dig a little bit deeper, a significant portion of those women have a history of trauma, physical abuse, emotional abuse. And those experiences, right? Our nervous system is trying to adapt in the best way it can,
Mhm.
sending signals to our immune
Mhm.
system
Right.
and our skin into our endocrine system, just in service of our survival.
Right.
But the expression of how that manifests, right?
Right.
We see it with psoriasis, alopecia, scarring alopecia, um, alopecia areata, vitiligo.
Wow.
So knowing that now,
Yeah.
my mission is to bring a trauma-informed approach into the field of dermatology
Mhm.
to teach individuals living with these conditions
Mhm.
the skills, tools, and resources to help bring their nervous system back into regulation.
Mhm.
Doesn't mean that they'll never get
A
sense of
flare.
anxiety, but it won't take them down a dark spiraling hole. Like they'll be able to stay in what we call the window of resilience
Mhm.
with more ease.
Yeah. Wow. I love so many things that you said. I love even the fact that sort of opening the definition for trauma to be so much more inclusive to the human experience. I admit before I started learning about it, I also had so many judgments that it had to be something really horrific, violent, poverty, incarceration, and it I had judgments then about my own lived experience or life experiences that I would maybe not validate or belittle or whatever. I wouldn't process, I wouldn't allow them because they didn't fit what I thought was traumatic enough. And I think just you saying that and allowing people to play with the fluidity that, there's you can use a different definition. It can be back to what you're saying that it's preventing you from being in your function, I guess is how I interpret it. I don't correct me, please help us reorient us. But I love the way that you kind of expanded that for people to really take it on and play with it and validate their own lived experiences in a way that can be healing.
Yeah,
Yeah.
I think it's really important to recognize that one of my mentors said, most of the people that will come to us, right?
Mhm.
um, have had some sort of traumatic experience, as clinicians, those in the helping and healing professions also have had some attachment and some trauma in their history. And if you think about medical training in general, it is the ultimate requirement that we have to disconnect our mind from our body.
Mm.
And you have to compartmentalize your feelings and you have to deliver really bad news to someone,
Yeah.
not be all in your feelings. You have to like shut that part of yourself off.
Yeah.
So by definition, our medical training
Yeah.
is cumulative,
Sure.
traumatic. Yeah. And
Yeah.
if we are not, this is why I'm grateful that you do what you do, right? Offering coaching and support and a safe space and container for people to process, metabolize, and move through some of these experiences because it's nonstop. And then
Yeah.
there's secondary trauma, right?
Mhm.
From reading all the news and things that happen with hospital administration. I mean, we all are in many ways the walking wounded, and
Mhm.
we have to um, give ourselves that grace and space that, right? It doesn't always have to look like these significant, horrific things, not to negate those. Those are, don't wish them on anyone, but it's the small insults, right? The
Mhm.
comments that stack up and they can have a cumulative, significant impact on our overall health and well-being.
Yeah, that's so true. And maybe such a great opportunity for us as a culture, society, field to explore with some more compassion and openness. How can we incorporate, invite the discomfort, the pain, the healing for the healers as we do the work? So that's a good challenge for our future. And I think what's so beautiful about you is you, I feel you have this real, like, authentic take and lens on it because you've done the work yourself. It's you've healed yourself so that now you can heal others. And I think that's such an empowering example to live by. Like, wow, if Kira can do all this, maybe I have hope that I can do a fraction of what she's done?
Listen, I appreciate that. And also to stay in integrity and to be authentic. I don't know if I'm healed. Have I done some healing? Yes. With the analogy of skin, right? I've exfoliated many layers,
Mm.
but there are many more. Like I keep discovering more. And that's, I guess, the beauty, the opportunity
Hmm.
is it's never done.
Yeah.
Like I'm in a training right now about healing attachment wounds.
Mm.
And we had a class yesterday about anxious attachment, no, avoidant attachment. Last week was avoidant, avoidant attachment. And the instructor, she's a psychologist, and she was just listing the examples and what happens. And I was like, oh my God. Like I started crying. I
Mm.
started crying because I was like, oh, that makes so much sense. And I think that's what I love about this work so much, right? So many of us think that we're broken, that we need to be fixed, that this is just the way I am. And I would just offer that none of us are really broken, that there are things that happened where we didn't have the time, space, or support
Mm.
to be able to understand, to be able to process what was happening, especially as kids. Like you look to your caregivers as to protect you, but when they're the perpetrators, right?
Mm.
Whether intentionally or unintentionally, right? The more we learn about intergenerational trauma,
Yeah.
transgenerational trauma, like they don't, like you can't, right? You can't always give what you didn't get or what
Right.
you didn't. And so, um, anyway, all of that to say is, I do, as I said, started at the beginning, like I do this work because I need to do this work.
Hmm.
Like I got to be in it with the people I'm working with because like I do get it. And also, like, I might be a few steps ahead, but I am very much still on this journey, you know?
Oh, yeah, I mean, I feel you, and I hope that my whole life is on this journey. And I love your exfoliation analogy because maybe that's the skin's lesson that we're in constant shedding and constant renewal. And there's nothing wrong with that. Actually, it's how it's designed to be, right? Like, I don't know,
Exactly.
as a living, breathing organ, it's living and dynamic. So I'm gonna adopt that now.
Yeah. And that's the thing, like with skin, right? We have been taught, especially socialized as women, if you have a blemish, you got to cover up, you got to camouflage it. Um, but your skin is always just a source of information.
Mm-hmm.
And I think most people just see their skin as a source of pain and shame, but our skin is also the source of the most exquisite pleasure, right?
That's true. Yeah.
The touch. Like there's so much research now on these um, C-tactile fibers. Right, our skin is a sensory organ, and these C-tactile fibers with slow, gentle stroking motions, they are directly linked to the parts of our brain that help us regulate positive emotion.
Mm.
This is where massage, right? This is why when you go to get a massage, you're like, "Ooh, that feels so good," because it's tapping into those centers of our brain. But the beautiful thing is that you can offer yourself that self-touch, and just even noticing, like where when you lay your hand on your skin and no, just noticing, does the pressure, little pressure, deeper pressure, what feels good, right?
Mm.
And then even without sliding your hand on your skin, but just like firmly placing it and just moving the tissue, right? Because the fascia is this beautiful interconnected network. And just even noticing where your skin is saying yes and
Mm.
where it's saying no, like what direction it wants to move. And you follow that. It's like, right, that body wisdom.
Mm-hmm.
And if you're willing to stay with it, I guarantee you, your body at some point will just go, it'll just
Ah.
take a breath. So we can offer these things to ourselves. Like our skin can be this exquisite source of pleasure that you can offer to yourself. You can engage with a partner. Like it's so cool. Like you partnered, unpartnered, you can have a lot of fun.
Yeah.
Skincare can be a lot of fun.
I love that so much. You are such a beautiful soul. Oh my gosh, your patients are so lucky to have you. Do you take, like, who can anybody come find your services? How can we work with you? How can we learn from you?
Yeah, no, I appreciate that. Yeah, so I, also certified as a coach, as a life coach. So I do work with people around the world. I typically work with midlife women, right? Because I am one of those midlife women, women who are in the perimenopause, postmenopause phase of life, who may be experiencing hair loss or skin changes. They're feeling a little uncomfortable in their skin.
Mhm.
Individuals who are struggling with, like there's a disease, hidradenitis suppurativa, just did a beta program. We're going to be doing an IRB approved study to take them through my somatic skincare program.
Wow.
So really kind of across the gamut, anyone who yeah, they're feeling a little uncomfortable in the skin that they're in, whether it's because of a visible skin condition or because of anxiety, stress, overwhelm, and they're open to using a somatic approach, which is soma is derived from the Greek word the body living in its wholeness.
Wow. That's like a
So,
mic drop moment right there. The body living in its wholeness.
right.
Wow.
Right. So there is, there's talk therapy, I guess, which is that top down. But
Hmm.
we know that when we are stressed, the brain research shows that like our thinking brain goes offline.
Mm.
And the brain MRIs have shown like that a lot of these experiences are stored as body memory. So we have to work with the body, which is what we call a body up, like a bottom up approach.
Okay.
So working with the body, the movements, the gestures, and being able to release the stuck energy, release that stored energy, so you can move the stress through and your body can complete the stress response cycle so that that nice network
Okay.
can start talking to each other a little bit more.
Wow. That's
clearly.
beautiful. Yeah. So is that something you'll guide people through is feeling
Exactly.
into their body and feeling into the movement and helping them make that completion?
Exactly.
Okay.
Exactly. So it's just a different approach to working through overwhelm, anxiety, stress, chronic pain, any chronic illness. So much of it is tied to that mind-body connection, nervous system dysregulation. So, um, yeah, I work with all kinds of people, but it requires that you're willing to go beneath the surface, go a little bit deeper. Then I'm not going to be the one who's just going to give you a supplement or, you know, an
Yeah.
affirmation or anything like that.
Yeah. Yeah. All good.
But it can be really fun. It can be really, really fun. But it's definitely different than most people say. Like, I feel like I just had 20 years of therapy in a session,
Wow.
and it's not like anything that I've ever tried before. So
Mm.
it's definitely different.
Yeah, that's so beautiful. And it really sounds like the missing piece, like maybe something that I don't know, our elders or these ancient cultures who are so much more connected to the earth and to their bodies knew, and somehow we've lost when we, yeah, sort of overdeveloped or had this importance on cognitive performance and innovation. And it just seems like such a beautiful remembering that you help people with.
Yeah, I mean, if you think about the language of the nervous system is sensation. The
Mm.
language of the body is movement,
Mm.
right? Movement of blood flowing through our vessels, lymph through the vessels, digestive juices, like even digestion is movement, right? Physical
Yeah, you're right.
emotion. Skin is the expression of how those other two are communicating, the quality of that communication,
Mm.
right? When the nervous system is dysregulated, the body is, now getting signals of inflammation, your skin is going to express that. So that's kind of how, like, you bring the skin back into it. But
Makes
I
sense.
think, yeah. So,
Yeah, that makes sense. Full circle. Yeah, yeah. I want to also respect your time. Is there anything else you want to share before we go?
yeah, I think as clinicians, right, you deserve to be seen, heard, held, and understood. And that it's a cliche saying, but you cannot pour from an empty cup. And we are taught in medical school and in training that in order to be a good clinician, we need clinical pathologic correlation. We need to like know all the latest drugs and the innovative procedures. But really, like you said earlier, we are just humans, and the basic human needs are connection, to be seen, heard, and understood. And so when you walk into a room and it's a complicated patient or a frustrated patient, complex case, like sometimes it's okay not to know what to do next,
Hmm.
but to just, use your presence and have the person in front of you just feel felt.
Hmm.
And I think that's the best medicine we can offer anybody.
That's so beautiful. Yeah, it's nothing you can bottle up. It just has to come from your own inner, the courage to give that love and to, yeah, express
Yeah.
it and
Put
connect.
yourself first. And I think we beat ourselves up when we don't have the answer. And so I guess my invitation is you don't always need to have the answer,
Mm.
but just invite yourself to be present. And sometimes that's enough because as a physician, you might be the only person that that patient has contact with who will listen to them, who will talk to them.
You're
So
so
it's
right.
okay if you don't have all the
Yeah,
answers.
right,
That's all
right.
okay with.
Yeah, they're so right. Yeah, healing can come in so many ways. Who are we to judge what it, what it looks like? Because it's not a diagnosis or a physical medication, but could there be, yeah, healing through other things that maybe
Connection,
we don't value?
right?
Yeah.
Healing through connection.
Yeah, I love that. You are such a beautiful human. Thank you for all of the work that you do. Thank you
You.
for sharing yourself and your time with us. How can people find you, contact you, work with you?
Yeah, so I'm excited. I'm in the process of updating my website. So
Yay.
soon it will be online at drkirabarr.com. You can find me on Instagram at Dr. Keira Barr, or LinkedIn, but I'm not as consistent there. But those are probably the two places, or, just on one of those, you could always email me. And if you're in need of resources, even if it's not to work with me, I am like you, like I just collect. I love learning and all the things. I'm happy to share whatever I can to help support
Amazing.
our
And you
community.
also had a series of podcasts, the
The
skinny
skinny
dip.
dipping prescription. Yes,
Yeah.
it's probably going to be rebranded as the Mind Skin Medicine podcast. I put it on hold because, coming back to authenticity, put it on hold in January. There's a bunch of episodes, and I'm proud of what I put out, but I felt like it wasn't as aligned with the direction I wanted to go, so I pushed pause. And as us perfectionists, you know, hard driving people, like it was hard initially to acknowledge like you just need to take a break, but I did.
I
But
love
it's still
it.
there
Well,
if people want to
yeah.
listen.
Yeah, it's a good resource. And yeah, it had, well, now we exfoliate to the next new layer of
Exactly,
skin to shine
exactly,
through.
exactly.
Oh, I love you so much. Thank you, thank you, thank you for all that you are, all that you do. I can't wait to continue to learn and grow from with you, learn from you, and celebrate you. Thank you.
Be right back at you.
Okay, for our ending tradition, we just try to pitch a few questions that people can ask to themselves so they can do some self-coaching at home, in the shower, in the car. Is there one or two questions that people can ask themselves? I mean, I think even the ones you offered earlier of like, what is my body trying to tell me?
Mhm.
Is a great question. Is there any others you would invite people?
I think, what can I offer myself in this moment that would be supportive, right? Like, what do I need to hear sometime, right? We've got the negative Nelly in our ear, but like, if I was talking to my best friend, what would I say to her? What would I need to hear in this moment is really, that's bringing in that self-compassion, but it can be really helpful. So yeah, those are two, like what might my body be trying to tell me? What can I offer it? And what might I need to hear in this moment to offer myself a little support?
I love that. Thank you. And thank you to all our listeners. Wishing you play, possibility, and peace. Wishing you to feel supported in this space and so honored to be a part of your soul tribe. Sending you love and see you next week.